大家好，午安，多謝大家參加我哋呢個雙語嘅新冠狀病疫嘅第3個城市論壇。之前嗰2個論壇呢已經係錄影咗，放咗喺一個網站上邊，叫 ahi.ucsf.edu， 請你哋得閒上去睇啦。我知道參加呢個論壇嘅網友呢係唔止本地嘅人士嘅，亦都有來自不同嘅州份啦，甚至係海外嘅人士亦都有嚟參加，歡迎大家。琴日咧喺美國就正式開始咗呢個全國護士週嘅慶祝，咁咧就等我諗起咗我嗰啲護士同僚啦，佢哋真係好多人咧都係好好嘅，佢哋用佢哋嘅愛心啦、熱心啦同埋關心咧去照顧病人，等佢哋早日康復出院。咁佢哋同其他醫療隊嘅同事咧，包括醫生啊、藥劑師、營養師啊、做行政人員啦、環境清潔啦、飲食嘅，甚至係運輸同埋做物品供應嗰啲人員咧，佢哋一齊咁樣同心合力去應付呢個新嘅冠狀病毒。佢哋嘅工作係保持咗醫院嘅高質量嘅服務同埋水準嘅。咁當然係非常之多謝佢哋，亦都希望佢哋能夠繼續努力喺呢個逆境之中一齊抗敵。Thank you all for joining us today in this third bilingual town hall on the novel coronavirus, COVID-19, for the community. The 2 previous town halls have been recorded, and you can find the YouTube recordings in this website, ahi.ucsf.edu. I know that we have attendees from not just locally, but also from different states, as well as overseas joining us. Welcome to all of you. Yesterday started the celebration for the National Nurses Week in the United States, and it reminds me of the great work of our nurses helping us get well when we are sick. They, along with all the other colleagues, that's physicians, pharmacists, dietitians, administrators, environmental services, transport and supply chain staff, all help to tackle the new coronavirus endemic and keeping the hospital running with the same high quality. That's really, really great. Thank you to every one of you. 我係加州亞裔健康研究院嘅主任劉雪艷，亦都係今晚嘅論壇主持。我哋將係以粵語同埋英語嘅形式進行呢次論壇嘅。I am Diana Lau, Director of the Asian Health Institute and Moderator for this evening's town hall. We will be conducting the town hall meeting in both Cantonese and English. 今晚嘅論壇咧就包括咗3個部分嘅，同以往一樣，有簡介啦、小組討論啦，同埋係回答你嘅問題。As in the same previous town hall formats, the agenda has 3 parts: an introduction, the panel discussion, and then a Q&A session at the end. 咁我而家咧就想介紹一下喺呢個論壇上面嘅2位醫生，一位就係陳子平醫生，一位咧就係陳福和醫生，歡迎你哋。Let me first introduce the 2 medical experts here to join us in this town hall today, Drs. Peter Chin Hong and Dr. Jasper Chan. Dr. Peter Chin Hong, 陳子平醫生 is Professor of the Infectious Disease Department at UCSF and the Associate Dean for the UCSF regional campuses. Dr. Chin Hong is Director of the Immunocompromised Host Infectious Disease at UCSF and has also received several distinguished teaching awards. 陳子平醫生係加州大學舊金山分校醫學院傳染系病嘅教授，亦都係加州大學全部校區嘅副院長。陳教授呢，亦都係 UCSF 低免疫功能傳染病計劃嘅主任，佢係獲得過幾個傑出嘅教學獎嘅。咁另外一位呢，就係 Dr. Jasper Chan 陳福和醫生。Our second panelist, Dr. Jasper Chan, is a clinical assistant professor in the Department of Microbiology at the University of Hong Kong and a clinical microbiologist at the Queen Mary Hospital in Hong Kong. His research focuses on antiviral medications. 陳福和醫生係香港大學微生學系嘅臨床助理教授，佢亦都係瑪麗醫院嘅臨床微生物學家 佢哋研究咧係注重喺抗病毒嘅藥物。Slide number 7 is a world map made by the Johns Hopkins University. The red part denotes the areas of the world that's being infected by the COVID-19 pandemic. On the left-hand column, you'll see the number that's over 3.7 million. That's the total number of confirmed COVID infections in the world, and underneath it listed the countries. The right-hand side shows the number of 263,146. That's the global deaths caused by the virus infection. And on the very bottom corner, you see the yellow line going up. The yellow line is the average line for the number of cases of COVID infections in the world. And we are not seeing the peak yet at this time. 呢張圖呢係一個世界地圖，由呢個約翰霍普金斯大學做出嚟嘅。紅色嗰啲地方呢，就係受咗呢個冠狀病毒感染嘅國家。咁差唔多你見到全個世界大部分嘅國家都受咗感染㗎啦。咁喺左邊嗰度呢，大家見到嗰個374萬嗰個字呢，就係我哋已經有多過300幾萬嘅人呢係受咗呢個病毒嘅感染，而右邊嗰度呢係睇到呢係多過26萬嘅人呢已經因為呢個病毒死亡。咁呢啲數據呢係由5月6號嘅時候攞出嚟嘅。咁喺右下角嗰度呢，就見到黃色嗰條線呢，就知道呢個病毒呢喺呢個世界上面呢仲係鼠升緊嘅，我哋仲未見到個頂啊。Do you see the curve still going up, Dr. Peter Chin Hong and Dr. Chan?
The curve is still going up, but the U.S. is very different from area to area. So as the audience knows, the total number and the shape is not reflective of different parts of the country.
咁陳醫生咧就話依個線咧係全世界嚟講平均線咧就係一直上高嘅，但係美國嚟講咧局部地區性咧係有不同嘅線，係即係未必一定係跟住佢咁樣上嘅。So this slide, part of it I used in the last town hall, and then the yellow part, and that's the gray part. The yellow part is the new part that I just did yesterday. So you can see the comparison now. So the last part, if you can see the middle was done on April 22nd, and then the yellow circle is done on May 6th, yesterday. So if you take a look at the numbers, and these are just the deaths in the world in 2 weeks. This is exactly 2 weeks. You have 264,000 now, and that was 181,000 before. So there's a huge increase in the number of deaths in the world still, over 20,000. And then in the US, that's even more astounding in terms of percentage. From 46,000, it went up to 74,000. That's like 26,000 more. So that's a high jump. But if you look at China, it's hard to believe the data is so good, but that's what it shows. I double check and triple check in multiple places. So they had 32 deaths 2 weeks ago, and they only have only one more 2 weeks later. And that's all I can find anywhere. Dr. Peter Chin Hong and Dr. Chan, you want to comment a little bit on this?
Yeah, I would love Dr. Chan to talk about the Chinese numbers and whether or not it's believable. I mean, I think I do believe in it overall, but I think there are some people who think that China might have not given all the information for the number of deaths.
I am only in the position to comment on the data in Hong Kong because I really have known the people and known the team working here.
Yeah.
So in Hong Kong, we have slightly more than 1,000 cases, and only 4 have died so far, and less than 20 have been admitted to ICU. So it's very difficult to comment on the different parts in China as the same for US, because we do have many different places, different provinces, and different levels of hospitals. So you have the state, and then you have the provincial, down all the way to municipal, or even less, more regional hospitals. So it would be very difficult to comment on all these statistics, whether they are 100% accurate. But I do believe that the overall trend has been markedly decreased since lockdown early in the pandemic, and now it is looking very stable in China. At least that is what we heard from our friends who are working in mainland China.
Okay. 咁我哋即係正話係講一講呢啲 number 就係話中國嗰度2個星期只係多1個死亡嘅案例，咁我哋話係咪可信咧？咁因為阿陳醫生咧佢話淨係佢大概知道即係喺香港嗰啲數目佢知道，但係香港咧都冇增加到，香港呢3個禮拜都係4個人死亡，都係維持翻4個人死亡，都係冇增加㗎。咁大陸嗰度嗰啲數據咧，咁即係我哋查過，我不同嘅地方查過咧，都係增加咗1個 case 嘅啫。但係我哋而家係即係冇咩方法去話佢係真呀假咯。So Dr. Peter Chin Hong, this is another slide that always bothered me when I saw it. This is from the San Francisco DPH website, and it shows the different races of the deaths in San Francisco. And you look at it, we have, of the 1,700 cases, we have 31 deaths. See the 31 on the top? That's the number of deaths. And out of that, on the bottom bar for Asians, 16 are Asians. That's very bothersome to me. What do you think?
I think it's a tough situation to really understand. I think we're working together to try and understand why there's so many, why the proportion of Asian deaths are so high as they are. But the number overall is very low. So the precision and the difference between races is really hard to tell with statistical precision. As opposed to when you look at New York data, they have lots and lots of deaths. So when you see a difference between two groups, it's probably real because it's statistically significant because they have a large number. When you have just 31 deaths, it's really hard to make inferences about really whether or not that difference in Asians and non-Asians is really true. But it is something that's bothered me also, and I think we're looking and continuing to watch this very closely.
咁呢個係我哋三藩市嘅死亡病例嚟嘅。咁呢個因新冠狀死亡嘅人咧，就係總共我哋而家係31個。受咗感染嘅咧就係1700幾個啦，但係就死亡得31個咧，其中咧16個咧就係亞裔喎。咁我就係問 Dr. Chin Hong 咧，就係有冇咩原因係多過一半嘅人係亞裔嘅咧？即係其他嘅族類加起上嚟都係15個，即係我哋有16個嘅。咁Dr. Peter Chin Hong 咧就話而家可能呢個數據太過少。咁其實都係嘅。如果我哋睇翻加州嘅病例咧，加州嗰度咧都係10零個 percent 冇而家呢個咁樣52個 percent 咁犀利嘅。呢個16 over 31咧係52個 percent， 咁係冇咁多嘅。So I was just saying that in California, in the state of California, it doesn't show these kind of numbers. It was like 16.5% death rate for Asians, which is very similar to the proportion of Asians, which is at 15.4%. So this is what we were doing for this last weekend, since the last week. Open, close, who is going to open, who is not going to open. So obviously it differs across the nation, right? So just to point out, the yellow part are the partially opened or still stay closed areas. The green part is the part that has been partially opened for good. And you see that a lot of the middle states and over in Florida, Mississippi, Louisiana, those areas. And then the light green part is the part that is considering to do away with the restrictions now, and that they will reopen soon, probably at the end of the week. So this is what we're seeing now, but we are sure that in the next week or two, a lot more are going to open up, and this picture is going to be a lot more green than yellow. And so Dr. Peter Chin Hong and Dr. Chan, for Hong Kong, you also have restrictions, but you're also loosening up. And so here we are trying to loosen up more. And there are a lot of conflicting feelings about whether we should adjourn or how should we, and whether we are going to pay for the freedom with blood and with more people, with more deaths coming up, and whether if we are opening up, if that would lead to a second wave of the pandemic, for the U.S., sooner than later. And so there's a lot of concerns and worries. Your comments?
I'd like to hear Dr. Chan talk about maybe the decisions that Hong Kong made. But I found it very interesting, and we talked about this before with some of your colleagues, Dr. Chan, that the restaurants in Hong Kong were always open throughout the whole time.
So, we Chinese like to eat. So that is probably the most important thing, one of the most important things, to have good meals. Now, I think it depends on several factors where the government has to decide on the opening or closure of the borders. So in Hong Kong, we really never had a 100% or complete lockdown like Wuhan. We still kept our borders open, but how do we achieve a relatively low number of local spread cases is related to a few things. First is you need to have really enough testing capability in the laboratory. So while we keep our borders open, we have imposed regulations on all people entering Hong Kong, either they're returning citizens or travelers visiting us. So they have to do a deep throat saliva test by PCR collected at the border. So the test result would be usually available within a few hours. Then we would have to ask them to quarantine themselves for at least 2 weeks, and they would be monitored. So this is against law if they do not follow these regulations. The second thing is we are quite different from many parts of the Western world where we do believe in universal masking. So I understand that my relatives who are working in Toronto and Quebec as clinicians, they are actually asked not to wear masks at workplaces. In Hong Kong, it's very different. So we make sure that not only the healthcare workers wear surgical masks, and when doing aerosol generalizing procedures, we also put on N95 and PPEs. But also, even in the streets, you would see people, just lay people walking in the streets. They are also wearing masks. So even if you get infected from, say, an infected and relatively asymptomatic person who is coughing at your side, you will still be able to at least reduce the viral load through the wearing of masks. This is the theory behind this policy. So I don't know whether this is also being done. I guess it is more commonly practiced among the Chinese community in San Francisco or other places in the US. But I understand that a lot of people still do not believe in the wearing of masks. So that is another issue that you have to consider. The third is, of course, as Professor Ching Hong has just mentioned, in the United States, which is a very big country, the statistics and the cases involved in different states would be quite different. So it really depends on the local state's situation, whether each state should reopen at what time. So I think these are the situations and measures that we have taken in Hong Kong, which may or may not be directly applicable to US, depending on your situation and also the cultural practice.
Now, before I give my comments, Dr. Chan, can you say that in Cantonese as well?
Oh, yes, okay. 關於重唔重開咧，其實係有幾個情況同埋因素要考慮嘅。第一喺香港，大家知道咧，我哋係做咗幾樣嘢係我哋覺得好緊要嘅。第一就係我哋從來冇咧，一路到而家咧係嘗試過係完全咁樣封咗關嘅。即係我哋一路咧仍然係有遊客嚟到香港啦，或者我哋係有一啲香港嘅市民出咗去翻嚟。咁但係我哋要求乜嘢咧？有幾樣嘢。第一樣就係佢喺嗰個邊境嗰度咧係需要做一個快速測試嘅，做呢個 PCR 快速測試。咁我哋嘅做法咧就係用一個深喉嘅唾液口水。咁我哋喺幾個鐘之內通常就會知道個報告。第二咧就佢翻咗嚟之後咧要有14日嘅自我隔離嘅，即係醫學監察。咁如果佢周圍唔聽亂喺條街走，又冇跟指引咧，佢係會俾人即係有一個法律上嘅責任啦。咁第三咧就係我哋相信能唔能夠重開一個州或者一個城市咧，好取決於當地咧佢嘅疫情。第一，第二就係佢其實有冇足夠嘅實驗室去化驗嘅能力。 譬如話根本啲試劑或者啲實驗室人員根本已經唔可以再做更加多嘅測試咧，咁你貿然咁重開咧係有一個風險，因為大家知道咧今次嘅新冠肺炎咧同以往譬如沙士咧唔同嘅一個好大地方就係今次咧有好一部分病人係冇乜病徵，甚至完全冇病徵。咁於是乎你咧就可以喺身邊一個唔為意嘅人裏邊咧惹到。咁有一個好大重要嘅亮點或者一個唔同嘅採取嘅手法，我哋喺香港做咧就係大家都會戴口罩，唔單止係醫護人員。喺街上面，如果你見到咧，普通嘅市民咧，我哋超過90%咧都係有自發咧去戴呢個外科口罩。咁即係話，如果你真係唔好彩喺個社區嗰度接觸咗一啲病人咧，佢就算咳落你度，你起碼都有個即係口罩互相保護住，佢又減少咗噴出嚟，你同時間亦都係減少咗。咁但係我哋知道喺西方社會，特別係一啲唔係華人嘅地區咧。佢哋係好多都未係真係好相信係要做呢個 universal masking 或者全民戴口罩。咁我哋即係當然我哋就覺得好緊要啦。咁亦都好睇你哋當地有冇足夠嘅口罩啦，亦都係能唔能夠供給到俾普通市民。Okay, thank you, Peter.
Great, thank you.
Dr. Chan. So I'll give my comments. I'll first talk about the good news because San Francisco, and the Bay Area, like Hong Kong, has increased testing. So I think that's a little bit less of an issue. But I would like to see better, more diverse kinds of testing done. I've really liked what our colleagues at University of Hong Kong U did with the saliva. I still think even though it's FDA approved, not enough people are using that. So that's one thing. We increased testing. Do anyone want to translate that or you want to wait a little?
Dr. Peter Chin Hong 都係認為呢個測試係非常之重要咯。佢亦都好中意香港大學嗰度係可以用口水測試，因為呢個可以用口水測試，可以自己去吐啲口水落一個樽嗰度，去交啲樣本俾嗰啲實驗室測試咧，咁樣係減低咗好多人力去用嗰條棍去同佢攞個樣本嘅。
The second sorry.
I was just going to follow up with Dr. Chan about the saliva testing.
Yeah.
Do you make those kits yourself, the bottles and the media inside?
So, I mean, the bottles and the media are nothing really innovative or spectacular. It's available widely in almost every virology lab. The important thing is to show that the deep throat saliva under the correct collection methods can be as sensitive or not inferior to the usually used nasopharyngeal swabs and throat swabs. So that is important because we have actually collected data and published this showing that deep throat saliva would be useful. So as Diana has mentioned, if you are going to do a lot of testings and collection at the border, it is impossible to have all these patients being seated down and then collect the nasopharyngeal swab and throat swabs. And many of times you will need protective equipment for the personnel collecting the specimens. But if you just give them a bottle, they just spit into it basically. So that is easy for everybody.
Dr. Chan, can you say that in Cantonese?
Yes. 我哋嗰個深喉唾液嘅做法其實一啲都唔複雜㗎，係我哋用最簡單嘅方法去嘗試解決一個問題。咁嗰啲樽啊，或者嗰個樽裏邊嗰啲病毒嘅培養液咧，亦都唔係一啲好新嘅科技，好尖端嘅科技。基本上全世界做開呢個病毒學嘅實驗室都會有㗎啦。但係最重要係咩咧？我哋係能夠有清楚嘅即係科學證據咧，顯示到我哋用呢個深喉唾液唔係就咁普通即係你要叫佢喝一啖好似咳嚿痰出嚟咁樣深喉唾液嘅口水咧，係可以同呢個一般我哋採集呢個鼻咽嘅拭子同埋喉嚨嘅拭子咧，佢嘅敏感性咧係唔會有太大嘅分別嘅。咁而呢個我哋已經證實咗。咁變相就話咩咧？如果你要喺嗰個邊境嗰度做好多呢個採集樣本咧，其實係好困難嘅，因為你要個病人坐低喺一間獨立嘅房間，有一個專業嘅人員去幫佢採集呢啲標本。 但係而家唔需要，我哋只係需要每個人俾個樽佢自己攞一啖口水，基本上就已經做完。咁你可以見到，如果我哋要採集鼻咽拭子同埋喉拭子咧，基本上你係唔可能喺個邊境做好大量嘅呢個測試嘅。
So the second way in which we've improved in the Bay Area since the last time we talked is in contact tracing. And of course, Hong Kong did a very good job with that from the beginning because they had the workforce. We've been defunded in public health, so we didn't have the workforce immediately, but we got a lot of volunteers and we have to train them. And there's funding now to train 10,000 workers in California to do contact tracing, which means after you get a test, you basically find out all those people who are exposed to the person who is positive and you keep them away from the people who are negative. So if you do that for everyone, you can be successful. The test plus the contact tracing.
So 呢個其實陣間都會講㗎啦，就係我哋去跟蹤嗰啲有感染咗嗰啲病人，佢同邊啲人接觸過咧？咁係初咧，我哋係唔夠人手做嘅，咁淨係靠嗰啲 volunteer。而家咧就喺加州啦，最得閒加州啦，就有一個學院啊，特別嘅項目咧，係去訓練呢啲人去點樣做呢個追蹤跟蹤呢啲病人嘅接觸過嘅人同埋物嘅。咁陣間我哋有個 slide 可以睇到。So this slide obviously is just a repeat of what we were talking about with the New York Governor Andrew Cuomo not opening up, even though our president says that the states can open up and he's going to stand on his 2 feet. It's just in New York, we can see later on and see whether, he's really in a good place and time to open up a little bit. But 呢個咧就係紐約嘅市長，咁佢咧就係企硬話唔開放字嘅。So 呢個就係1918年嗰個 Spanish flu. They opened up too soon, and not only did they have a second outbreak, they had a third outbreak. So it was pretty tragic. So 呢個係嗰個西班牙嗰個瘟疫啊，1918年嗰陣時，佢哋因為太過早開放咧，咁嗰啲傳染咧就過完第一波就過第二波，再後一年咧仲有第三波嘅瘟疫，咁係死咗好多人嘅。So this is what people are projecting, the experts. This one is projecting on the number of cases. There's another one that projects on the number of deaths. But this one is saying that if we open up now, all the states in the states will open up now without any special precautions or letting people do whatever they do. We expect at the end of the month that we will have 200,000 cases a day. And then there's another slide which I didn't show, but it shows that at the end of the month, which is by June 1st, then we would have 3,000 deaths a day. So these are huge, huge numbers. We hope that it's not going to be true. We hope that they make the wrong projection, but it's very likely. And so 呢個咧，呢張圖咧就係估計，如果我哋而家暫時咩都唔做，就咁開放晒全部州喺美國嗰度，咁到月尾嘅時候咧，我哋咧就會有20萬人一個，即係每一日有20萬嘅新 case， 同埋每一日咧有3000人死亡嘅。呢個係一個非常非常大嘅數字嚟嘅。You both have talked about this, Dr. Chan. So you were talking about the masking, and last time Dr. To talked about the hand washing also, and the using the disinfectant alcohol, and social distancing is definitely always in place. But we also realize the social distancing is very hard to do. And then the testing has been our Achilles heel in the US. We don't understand why in the US we would have such a problem with testing. It's very, very strange. But basically, 呢個咧就係我哋而家嘅暫時咧就係話，如果我哋要開放嗰啲地方咧，我哋係要做最少要做3個措施嘅。呢3個措施係非常之重要。一個咧就係戴嗰個面膜啦，同埋洗手液啦。另外一個咧就係社交距離，即係盡量隔開啦。第三個咧就係我哋要多啲去做多啲測試，因為而家我哋做得唔夠測試嘅。So these are the people that we need to test, at least, in the least, right? So these are the places that has explosions of infections that we know of. nursing homes, correctional facilities, meat processing plants. We are not going to have enough meat in the supermarkets soon. And people who live in crowded places, and the people who, after you finish contact tracing, those people should be tested. Whoever that's been in contact should be tested. And there's no use to do contact tracing if you can't test them, if you don't have enough tests, right, Dr. Chin?
Yes.
So, and then we have the new infections from outside. So this place is not as easy as in Hong Kong, where you can control the airport and control the train stations, and then you can pretty much block people from coming in or put them on quarantine. But in the US, people travel from state to state within the United States. And then there are travelers from outside the states, obviously. And so right now we are doing pretty laissez-faire stuff about travelers that go in. So like now in San Francisco, we are doing a pretty good job keeping the virus down, right? But if we don't instill some of these measures, what's going to happen to us in San Francisco in a couple of months?
Well, I think, first of all, I would like to make the comment that the other state that did a really great job was Hawaii, because they forced all people coming into Hawaii to, it was almost like Singapore, where they had to find a place in quarantine for 2 weeks before they can leave. The difference is that the people had to buy their own lodging, whereas in Singapore, you get forced to go to a hotel. I don't know about Hong Kong, but so that's the difference. So maybe I think that, yes, I mean, I think all the things that you say are correct. And the most things that will be different for San Francisco in the Bay Area is when you reduce the restrictions, people will be coming in from the outside more. If the next state reduced restrictions, that has a higher number, and then it will make the San Francisco more unsafe.
陳醫生咧就係話喺夏威夷嗰度咧，佢哋係會將啲人咧隔離14日嘅。咁新加坡都係咁嘅。咁所以咧，佢哋咧係因為佢哋要可以隔離啊，因為佢係個島啊嘛，佢容易做呢啲嘢，咁咧就係可以將呢個瘟疫咧個疫情咧係降低嘅。So this is what you were talking about, Dr. Peter Chin, huh? You were talking about training. There is actually a contact tracing training academy. Being serious, we really need something like this. We have not been doing contact tracing well. 呢個係追蹤嗰啲病毒嗰啲訓練學校啊，係要訓練啲人去點樣做追蹤嘅。咁我哋叫佢做病毒偵探嚇，冠狀病毒偵探。A project between San Francisco Department of Public Health and UCSF and UCLA, but I think that is the state, California Department of Public Health, not just the San Francisco Department of Public Health. Of course, they will be part of it, but really overall is the California Department of Public Health. That yesterday, as of yesterday, it was launched. It's not in effect yet. And so the goal is to train 20,000 state employees for a 20-hour training, both online and in person. So they are going to pick state employees, no longer volunteers, but state employees to do the training so that they can do a better job. And of course, they are aware that with the minorities in the state, that they do need people who are bilingual and bicultural in both Spanish and Chinese and maybe other races. They're going to figure out what race they need, depending on the population. Dr. Chan, this is from Hong Kong. This is your Hong Kong mask. Are you wearing one of them?
No, they are just they have just announced this 2 or 3 days ago. So they are now distributing to people who register for this. So suppose there are enough for, I mean, almost every citizen. They have produced at least 7 million of these copper masks. So the CU stands for copper, right? So that is what they mean by having a CU mask, and it is said to be able to be reused, washed and reused for at least 60 times. So
which is great.
Which is great because you need reusable masks, and because we do expect that the virus will be with us for quite some time. It would not be like SARS, where we find the source in human and also in the animal reservoirs. And then you, I mean, basically control the epidemic within less than 1 year. So this new coronavirus will be with us for some time. So the supply of masks and other medical equipments would be continuously in need. and this is important. So we do believe in universal masking, and this is what we are doing.
And this is for you to get ready to open up more of Hong Kong, because Hong Kong also has economic pressures. A lot of businesses are going under, and so there's a lot of pressure on the government to open it up. So this is one of the strategies that they are giving this mask away free to all the citizens, right? To get ready for opening.
Correct.
So we don't have anything like this here in the United States, Dr. Chin.
No, we don't. I mean, I was just thinking, wow, I'd really love Dr. Chan to send some of that to us right now. But we have, the way the CDC has worked with this is to allow people to use homemade masks. So a lot of people, mainly, I would say mainly Asian people are wearing the regular masks, but the non-Asian people are wearing, a lot of them are making their own masks or buying them with different patterns. It's not going to be as high grade as these masks, but it's better than nothing. And I think it's better if it's more acceptable to people to wear those. I'm for it, as long as people wear them and it's more it's more part of the culture.
Great. So 呢個我哋喺美國咧就冇香港咁鼓勵人哋去戴 mask 咯，即係都有，但係好多人都唔戴咯。咁我哋而家咧就係因為嗰啲口罩仲係有短缺嘅嗰啲醫療口罩，咁我哋咧就係話戴嗰啲布口罩啦，自己做口罩啦，用條手巾綁住佢啦，或者用條絲巾綁住啦咁所以咧呢啲咁嘅口罩咧係冇香港做得咁嚴嘅。佢呢啲口罩咧有6層嘅，中間咧佢叫做 copper， 因為中間真係有銅絲喺度嘅喎。咁所以咧呢個口罩咧係應該係抵抗嗰啲病菌係好啲嘅。咁我哋就冇呢種口罩，但係咧都係話揞住個口就始終都係比唔揞住個口係好啲嘅。So now here we are in San Francisco. Last Friday, the governor announced that we're entering a 4-stage opening plan. And this is a roadmap. And it's going to be done with care and consideration and looking at the data as to whether we should or should not open. And at any stage, if the data shows that there's a flare-up of the infections, we can always go back. And that's the stance that our Governor Newsom is doing now. 呢個就係呢度而家喺加州啊嗰個開放嘅4部曲，咁咧就係1、2、3、4啦。咁我哋不嬲都喺 Stage 1噶啦。Stage 1咧就係即係你除非有必要就唔好出街嗰啲啦，嗰個就 Stage 1啦。咁啊 Stage 2咧就係今個 Friday 咧，今個星期5咧就會開始做噶啦。So 呢個就係 Stage 2啦。This is the second step that 我哋會開始開放一啲低風險嘅地方。譬如係零售業啊、製造業啊、辦公室啊，即係啲台層最少6尺分開嗰啲啦嚇。咁同埋咧有啲開放多啲公共嘅空間，譬如library 啊、公園啊嗰啲咁，或者係高爾夫球場啊咁樣，係會開放多啲嘅。This is our second stage. It's going to happen on Friday, Dr. Peter Chin.
Yeah.
So that we are going to open up some of the less risky places.
Yeah, but not all counties are going to do this.
Right. Not all counties are going to do this. So, but Governor Newsom says that we could, but then each individual county can evaluate whether we can do it or not. But I think that our mayor in San Francisco is planning to do so, right?
I think there's rumors that we may not actually in the Bay Area. We're going to be stricter and wait a little bit longer.
I see.
Nobody knows what's going to happen, but that's the rumor.
This is the data. This is the data in California to see where it's going, whether we are ready to open. And you can definitely see in the whole state, we definitely have ups and downs. And actually the trend is still going up.
Especially in Southern California and LA, it's still very high.
Last weekend, with many of the beaches closed, but there's a couple opened, and in those open beaches, there were tons of people, and they were cross-infecting each other. So this is San Francisco. Take a look. These are our cases in San Francisco. So it looks like we've plateaued, and looks like we are coming down. So you still feel that our mayor may not open on Friday?
That's the rumor, that we may be a little bit slower in the 5 Bay Area counties that are together, but not Napa and Sonoma. They are probably going to open.
So this is Hong Kong. This is a study that was done by Hong Kong U. I showed it last time because this is such an important slide. And I want to show it again this time as we are talking about opening. So this was a study that was done in Hong Kong, and that in the beginning in January, when the coronavirus infections were still not in Hong Kong yet, they did a study and they found out that people, they agreed to wear masks in about 75% of people. And by March, it was like 99% of people wants to wear masks. So that's why Hong Kong is having such a great control, right, Dr. Chan? It's all very cultural. People want to do it.
Well, I think one major difference is we had our blood being shed during SARS. So that was a very painful lesson. And since then, I think not just the healthcare workers in Hong Kong, but the lay people are also very aware of the severity that epidemic or pandemic can evolve into. So people are very very compliant to the recommendations of the team. And I do believe that is a sort of cultural thing, but also for a historical reason. So it's very easy to convince the lay public to do all these measures in Hong Kong, relatively easier than in San Francisco, I suppose.
And Dr. Chan, I also think in Hong Kong, the people also enforce it amongst each other. Which
yes. So it's sort of like when you go to high school, you have peer pressure. So if everyone is doing one thing you don't follow, people would start to look at you in a very strange way. So there is some peer pressure, even in the community, for wearing masks, at least covering your mouth with your hand when you cough or sneeze. These sort of things. So I don't know the situation in San Francisco, but this is what we have been doing in Hong Kong, basically.
Okay, so if you can quickly just say a few words in Chinese, what you just said.
大家記得喺2002年尾到2003年，香港係經過沙士嘅一役咧，係我哋上咗好珍貴，但係亦都係好多血同埋淚嘅一課啦。咁自從當時起咧，其實除咗醫護人員之外咧，喺香港嘅一般普通市民，佢哋都好明白一個疫情個急劇嘅轉變啦，同埋可以帶嚟嘅影響，包括嗰個死亡嘅數字嘅。咁所以咧喺香港，我哋作為一個專家團隊或者一個醫護人員，對要去將呢個信息再去教育啲一般嘅市民咧，就比較容易嘅，因為大家好自發性咧都會做呢啲戴口罩啊、勤洗手啊，同埋咧要保持社交距離嘅。咁特別當個疫情越嚟越嚴峻嘅時候咧，喺前一段時間，我哋嘅全港嘅市民都係好同心啦，係去跟足呢啲指引做。咁所以就變咗我哋喺個社區嗰個傳播鏈咧係比較容易控制到。咁我哋永遠都相信咧，其實一個疫症嘅控制嘅成功唔係能夠淨係單靠個政府或者個醫療團隊，而係需要咧喺個社會上每一個持份者，包括一般嘅市民咧，去有份同心嘅參與。
係啊，同心抗疫呢個字真係非常之重要。Dr. Chan, you are an antiviral drug expert, and so we want you to talk a little bit about that. OK， 咁我哋而家睇到咧，即係主要抗疫嗰啲藥咧係幾種嘅，一個咧就係疫苗啦，一個咧就係抗病毒嗰啲藥啦，一個咧就增加抗體嗰啲藥，一個咧就係消炎藥，咁或者仲有其他嘅。So the several classes of drugs that are being investigated now, of course, vaccines, antivirals, antibodies, and anti-inflammatory, and maybe some others too. So, but that's overall, in general, those are the areas of investigation that are being worked at now. So this is the coronavirus, or at least a picture of it. Okay, so it's a round sphere with spikes that goes out. And so 呢個新冠狀病毒咧就叫做核糖核酸嘅病毒。咁佢其實咧係一個 so it's a single helix RNA, and so it's comprised of 4 bases of nucleic acid. And so 呢個咧就係一個簡單嘅圖啦。Dr. Chan, maybe you should explain a little bit. You'll be better than me trying to do it.
But basically, when the virus replicates, it's using its own enzymes, and then once it enters whole cells, the enzyme machinery will start to help the virus to replicate through the production of RNAs, ribonucleic acids. In this case, one of the major enzyme in the virus is the polymerase. So it actually is very essential for the whole virus replication process. And basically, Remdesivir is a nucleotide analog that would, when the viral polymerase starts to continue to grab these AGCUs, it would actually replace it, and then the whole process will be delayed. So it's called delay chain terminator. And basically, once it replaces, competes with the normal nucleotides that the virus needs to use, then the whole viral load would start to decrease. So that is basically the concept of Remdesivir. 我相信我用廣東話講兩句啦。講你就唔好講太多嘅 details 啦。但係基本上咧，呢個新冠狀病毒或者其他 RNA 病毒咧，佢都需要一啲酶嘅。咁其中一個好重要嘅酶咧，去幫自己去複製咧，就係呢個polymerase 啦。咁呢個 polymerase 咧，佢一路咧會幫自己去攞呢個nucleotides， 即係呢個核糖啦、核糖核酸。咁譬如呢個 CUGA 等等，咁呢個瑞德西韋 Remdesivir 就係佢咧會令到佢代替咗佢要攞嘅 A 嘅，咁於是乎佢就可以令到佢咧係慢慢越嚟越製造唔到自己嘅複製唔到自己嗰個病毒嘅數量啦。
Through a common friend, I was able to get to know Monica, who is here with us today. And thank you so much for coming, Monica. Monica is a COVID-19 infected patient. She is now home doing her recovery, but she came back from the hospital not too long ago. And so thank you, Monica, for joining us. 咁我係好幸運，通過一個我哋大家相同嘅共同嘅朋友咧，係認識咗 Monica 嘅。咁因為 Monica 咧係一個新冠病毒嘅患者嚟嘅，咁我哋好高興咧係阿 Monica 咧唔介意咯，今日同我哋上嚟講一講佢嘅過程。因為實在咧，我哋從醫學方面咧，我哋有我哋睇啦，但係病人裏邊嘅心態咧就係另外一個世界嚟嘅。咁多謝你Monica 嚟同我哋分享你嘅過程同埋心態。
我自己個名係楊偉平 ，Monica Yeung-Arima。咁我去咗埃及翻嚟咧，就感覺有少少好似感冒咁樣。落機嗰陣時就開始覺得噶啦，症狀咧就係 achy bodies， 周身骨痛咁啦。And 咁我翻咗嚟之後咧，我就好快 check in 去嗰個 clinic 嗰度。咁我去 clinic 嗰陣時咧，就佢哋做 routine 嘅嘢，就 check 你有冇第一時間咧就係去 clinic 嗰度咧，就係佢唔會俾你入去 clinic 嘅。你同佢約時間嗰時咧，你就去揸車去個 parking lot 嗰度，然之後就打電話入去，佢會有人帶你入去個獨立房間嗰度嘅。咁就 check 咗咧就冇 virus 啦，咁冇 virus 啦，佢然之後先至進下一步，即係你可唔可以 check COVID-19 咁樣嘅。咁但係嗰陣時咧，因為我係比較早期嘅病人，佢哋仲未準備得好，所以嗰陣時咧就話唔 qualify。咁當然唔係好爽啦，咁啊即刻就同佢聯絡，話俾佢聽 CDC 話乜 ，County 話乜。咁最嬲尾咧，到禮拜一嗰陣時咧，佢就叫我翻去。但係未去之前咧，佢就已經俾咗啲 5日嘅 antibiotic 俾我食噶啦。咁但係咧，禮拜一翻去嗰陣時已經食咗5日嘅 antibiotic 咧，但係就好似冇乜作用咁樣。咁佢就幫我去禮拜一睇嗰陣時咧，佢就睇到我咧嗰個肺咧就好似有啲問題咁所以佢就不急幫我照 X-ray， 照完 X 光之後咧就覺得我就即係已經有 pneumonia 已經入到個肺裏邊，咁所以咧就要即刻入醫院。咁啊禮拜一嗰日咧就入咗去Stanford Hospital 噶。使唔使我翻譯好快咁啊？
好啊。
And I traveled to Egypt and I was back. On my way back, I feel like I'm coming down with something. And the major problem that I have is achy body and to start. And then I check into the clinic and get myself checked out with the general stuff, and it's all negative. So it went on ahead to be able to do the COVID-19 test. However, I'm one of the earlier patients, so they are not quite ready. So we were denied, and of course we persist. And over the weekend on Monday, they called us back in to do the COVID-19. Meanwhile, they gave me 5 days worth of antibiotic, which finished by Monday, but it didn't do anything to me. 咁第二樣嘢咧就係去醫院啦，因為去醫院咧就自己又唔可以開車，然後咧佢又唔俾我老公嚟車我，因為我已經係 COVID-19 patient， 我仔冇病嘅，咁所以冇即係佢冇同我哋一齊去旅行，佢冇病咁，所以又唔俾佢開車，咁要用十字車車咗我去，咁搞呢啲嘢咧，同埋咧佢要再做個 test， 即係。你雖然 clinic 度做咗，但係佢去到嗰度咧，佢又要做翻佢自己嘅 test， 同埋佢又要再照過個 X-ray 嘅。咁等由我1點幾去 clinic， 等到差唔多12點半夜晚黑半夜，我先入到去醫院個房裏邊。OK， 咁我就完咗嗰樣嘢啦。就跟住咧入咗醫院之後咧。佢第一樣嘢咧就幫你 IV 咗之後 ，IV 咧就加多另外2個 antibiotic， 但係呢個2個 antibiotic 咧，即係好似都冇乜反應咁啦。咁你話我症狀乜嘢咧？我就第2個禮拜嗰陣時入咗醫院之後咧，就開始有即係之前都有噶啦，有啲 fever 啦、咳啦，同埋 pneumonia 咁樣。咁咳好攰，咁樣就我多數 on and off 喺醫院裏邊咧就瞓覺嘅，咁就冇乜點樣醒嘅。咁啱咧，即係我哋知道咧有一隻藥就呢個 Remdesivir 就係治療過一個 Seattle 嘅人，佢好咗，咁所以咧我哋又想試。咁我老公咧就啱啱喺Gilead Science 嗰度退咗休出嚟嘅，咁somehow 即係 work together 就。Stanford 就開始做佢 clinical trial， 我就係佢第一個 Stanford 裏邊嘅 patients， 就用咗呢一隻藥。用咗呢隻藥之後咧，大約用咗呢隻藥用嗰陣時 apply 又係 IV 啦，就每一次用嗰陣時咧，大約5個鐘頭到，唔係半個鐘頭到，30分鐘到就已經可以輸完噶啦。咁每日一次，就我嗰個 trial 咧就係5日嘅，就做咗5日。After 即係。第2日之後咧，過後之後咧，我已經覺得好咗好多啦，即係覺得即係好似即係可以 free to move around 啊，去做第二樣嘢啊咁樣啊。咁做完之後咧，嗰一日咧我就 discharge 咗，唔係好晒，不過即係已經 good enough to go home to get rested and all that。And 如果要翻譯嘅話咧，就去咗after I was admitted to the hospital, they put me on IV。And give me 2 other antibiotics, but it's not really doing anything very much. So it just happens that we know the drugs of Remdesivir. So I was a clinical trial patient for Stanford, and the dosage that I have is 5 days. And after the second day. Of dosage, I already feel that I feel better. And after the drugs, the next day I was discharged and rest at home and recover at home. And 而家嗰隻藥咧就已經係 conditionally approved by 俾呢個 FDA 批准咗嘅，同埋公司咧就送咗呢一隻藥咧。1個 trillion dollar 嘅藥咧就俾政府，所以如果有人要用嗰陣時咧，就可以隨時可以 request 即係要用。咁當然係 subject to 你，即係當然係要等你嘅醫生決定，即係有冇用、有冇作用咁樣啦。And so the drug is for free, and is the company donated the drugs to the government. And I think that is worth $1 trillion. It's supposed to be able to cure maybe about 140,000 patients. 咁係咁多啦。如果有啲咩問題缺漏咗嘅，咁請大家問啦。And so that's it for me. And if you have any questions, ask me later on. 多謝各位。
Okay, Monica, 多謝你分享。I have a question for you. Were you tested to be negative before you were discharged?
Of course not. This is US the A. If you go by the rule of China, I probably is still in the hospital. We discussed this with other fellows in the WeChat group. It takes me a long time to recover my pneumonia at home. I cough and I have a lot of mucus until 2 days ago. I went back and I took an X-ray again. I still have portion of the part that is affected in the X-ray on the lower part. And
no test. You were not tested at all.
Actually, no, I was tested. I was tested with antibody. So last Thursday, I was X-ray and I was tested with the antibody. Both the IgM and IgG is positive. And I was tested with the antibody on March 25th, and both antibody is positive. And I was tested with PCR test on the 13th of March, which is positive. And then I wasn't tested on discharge on 20th. And then I was tested on April 10th per my request. It was negative.
Thank you. Thank you so much. I hope you get well.
Yeah, thank you, Monica, for being so courageous to share your story. I think it means a lot to all of us. Thank you.
You're welcome.
多謝晒 Monica.
Yeah.
多謝。Dr. Peter Chin, is that a pretty typical scenario that Monica described?
Yeah, so first of all, I will talk about her symptoms. It's very typical, although I would say Monica was lucky because many patients get sicker and they go to the intensive care unit and they get a breathing tube or mechanical ventilation. So Monica was fortunately spared that. And that is even a longer recovery period. But it still shows even for mild or moderate disease, people take a long time to feel themselves again. So it's, that's going to be when the dust settles, you're going to have a lot of people in the society not feeling well for a long time.
Great.
May I say something?
Yeah.
I do have oxygen substitute all the time, but I just don't have ventilator. I use the tubes on my nose.
The nasal cannulas. 即係 Monica 一路入醫院咧係有嗰啲氧氣支持住佢嘅。咁啊 Dr. Peter Chan 咧就係話佢嗰啲症狀咧都係一個受咗感染嘅病嘅症狀，都係非常之普遍見到嘅。不過佢咧就話阿 Monica 好彩咧就係佢未到呢個插喉管嘅情形咧，佢就已經有隻藥去救佢啦。So it's true, a lot of patients they don't get the drug until they're intubated because there's not enough drugs to pass around, right?
But Monica was part of a trial.
Criteria for the study.
So part of a trial where they was at Stanford at that time. There was a trial of 5 days versus 10 days, and they reported that data. It shows that 5 days may be equivalent to 10 days for not so sick patients, and that's why we can probably, because of Monica's participation in this trial, we can potentially treat more people in the United States than 10 days for everyone.
So patients have to be treated sooner before they get so sick.
Yeah, we have about 24 people participated at the end of the clinical trial. 6 of them is in placebo, and the rest of them is on the 5 days and 10 days that are randomized. I don't even know that I was in 5 days until the night before.
即係呢個研究咧係可以俾5日藥你或者係10日藥你嘅，但係因為佢係 IV 咧，所以你一定要係喺醫院嘅病人，你先至可以受用到呢隻咁嘅藥。咁佢Dr. Peter Chan 咧就話，因為嗰啲病人咧通常咧已經係插咗喉，同埋跟住嗰個呼吸機㗎啦。咁嗰啲人咧就係非常非常病得好嚴重嘅。咁所以咧如果呢啲嚴重嘅病人咧，可能係要長啲，可能要吊10日嗰啲鹽水同埋嗰隻藥咯。如果係好似 Monica 咁，佢未用呢個呼吸機，但係淨係用氧氣自己呼吸嘅咧，咁佢係冇咁嚴重，所以可能係用5日可以已經幫到佢啦。 Thank you so much.
I think I make a
correction for Monica too.
I think I want to make a corrections. I think the study said that they find that, no matter how serious you are, the 5 days and the 10 days dose is it find that the 5 days dose serve the same purposes of the 10-day dose.
That's what the study showed.
I have one more question for Monica. Monica, we hear about all these symptoms, and certainly have seen it in patients, symptoms that were strange for COVID-19. The one strange one is can't taste and can't smell. Did you have that symptom?
My husband have that, but I don't have that. I just, for my second week after symptom appeared, when I was in the hospital, I was just extremely tired. So I'm dozing off pretty much day and night. So I don't even know if I taste anything or if I smell anything, because I'm isolated in the room by myself.
And that's the other question I had for you. How lonely was it for you during COVID? Because you're isolated and everyone's coming to you in a mask.
It's because I'm so tired. I'm dozing off all the time. It wasn't so bad. And the first week when I was at home, I isolate myself already because I was worried about my son. So I don't want to pass it on to him. So I was isolated mostly in the bedroom. So maybe I ease myself into it. So it doesn't really feel that bad. I mean, for some people, maybe. I also have my iPhone with me, which people text me, and family from Hong Kong, and people in communication with me. So I wasn't feeling all that lonely. In fact, sometimes I said, can I call you back? Because I'm really dozing off.
Thank you. So we didn't realize that the iPhone is important, but thank you so much for sharing. We hope that you get better, all well, very, very soon, Monica.
Yes.
We'll go back to Dr. Chan. Dr. Chan, so there are a few more slides on the antivirals. Let's take a look at that.
So I think I'll just go through them very, very quickly. So I think we just want to illustrate here that when you have a very rapidly evolving pandemic, there are different ways to find antivirals. So the first two methods is to find whatever or you already have in your freezer and find out whether the old drugs can be used for the new virus. So broad spectrum antivirals or other drugs that are used for other purposes. We call this drug repurposing. So there are some drugs identified to be effective. For example, Remdesivir is one. Interferons and lopinavir and chloroquine or hydroxychloroquine. I'm sure many of you have heard this in the news and from President Trump's tweets. All right. So the other way to do it is to make new antivirals, but that takes a long time. So we are making new monoclonal antibodies, peptides, and so on, but that would not be available for human use at least for another year. So we are still relying on its first two methods. So we just want to share with you what we have been doing in Hong Kong. We did not have Remdesivir until quite recently, so we had to rely on our other available drugs. So from our previous works on SARS and also MERS, which is another coronavirus in the Middle East, we have identified a number of drugs that are active against these coronaviruses. So number one is lopinavir, ritonavir. So if you know HIV friends, many of them are taking this drug for treatment of HIV. The second is ribavirin, which is a very old drug that has been used for a lot of viral infections. The third is betaferon. So this is a drug, interferon beta, which is used to treat people with multiple sclerosis. Not an infection, but it's been clinically shown to be quite safe. So we actually have data from patients or non-human primates previously showing the effect. So what we did when we do not have Remdesivir is to have a combination treatment. So for any viral infections, usually you would need more than one drug as a combination cocktail to be more effective. So this is done in many other hospitals in Hong Kong. So this is our experience in SARS. You can see that when we gave lopinavir during 2003, there's basically a lot of data showing that there's clinical and virological improvement. Although this was not a randomized control trial, there's at least some in vivo data that we can borrow for this new coronavirus. This is for MERS, so we did not have patients of MERS in Hong Kong. What we could do is to collaborate with our friends in Beijing who had access to monkeys. So we used the common marmoset model. So you can see that without treatment, the monkeys develop very severe pneumonia, as in the x-rays, and also when you dissect the organs out, you can see the lungs are full of blood. So it's very bloody, just like when humans develop a very hemorrhagic pneumonia. If you give interferon to the monkeys, you can see that the pinkish areas in the lungs are the preserved normal tissues. So you can see that the bleeding is much less, the damage is much less, and the X-ray shows much better resolution and less pneumonic changes. So showing the effectiveness of interferon beta in the monkeys. Our paper has already been accepted. I think it will come out within the next week, but due to embargo issues, we cannot share this now. But we just want to show you the effect in one particular illustrative patient. So this is an elderly. So you know the elderly, they tend to have more severe disease in new coronavirus or SARS-2. So this is a 70-year-old gentleman also with underlying disease of diabetes. And he was on insulin. We gave him triple therapy. You can see on day one, the X-ray is very bad. So we were worried that he would deteriorate anytime. And you can see that in the CT is full of ground glass changes, compatible with the COVID-19 changes. But by day 5, after we have given him triple therapy, you can see the lungs immediately opened up and improved. So overall, our data show that once you give the triple therapy, the clinical improvement is quite significant. I hope that we can share with you the data next time after the embargo issue is over. So that's basically what I want to say. 用廣東話好快咁講啦。咁喺所有新發嘅病毒嘅疫情咧，大家知道我哋去一個好關鍵嘅手段去揾一啲有效嘅抗病毒藥。咁主要有2至3個方法去揾啊。第一個方法就係去用我哋現時已經有嘅藥。有一部分可能係已知道去對其他嘅冠狀病毒或者對其他嘅病毒咧係有效嘅藥啦。第二種咧就係其實可能佢係醫其他嘅病嘅，譬如話醫呢個血壓高嘅，但係原來佢係有一啲對呢個新嘅病毒係有抗病毒藥性嘅。咁呢啲我哋叫舊藥再用嘅手段。呢個方法嘅好處就係好快咧可以揾到一啲藥。咁唔好處就係佢哋唔係好針對性嘅，因為佢本身唔係設計係為咗呢一隻新嘅病毒。第二個手段咧就係全身做一啲譬如單克隆抗體啦，或者係一啲新嘅藥物，但係呢啲咧係需要好長嘅時間，講嘅係以年份去計。咁所以呢啲咧對喺最關鍵一開始嘅疫情咧係冇乜幫助，但係都係要做，因為遲早就會揾到啲新藥。咁我哋喺香港，因為我哋知道最近期先係攞到呢個瑞德西韋咧去做呢個臨床測試。咁喺我哋有呢個藥之前，我哋一定要諗方法咧去幫我哋香港嘅病人。而我哋嘅做法就係根據以往喺 SARS 嘅經驗啦、臨床經驗咧，我哋當時係發現咗呢個醫愛滋病毒嘅Lopinavir 係有相當嘅效用嘅喺病人身上。雖然當時咧唔係一個randomized control trial， 但係咧我哋都係發現咧病人嘅病毒數量啦，同埋咧佢嘅臨床反應都係唔錯。咁第二咧就係所以呢個亦都係點解中國即係國家嗰度會納入咗呢個 Lopinavir 喺最初期嘅時候咧，作為一個醫治嘅手段，就係基於呢啲我哋以往嘅研究。第二咧就係呢個喺中東呼吸道綜合徵嘅冠狀病毒 MERS coronavirus 裏邊咧，我哋係冇病人，但係我哋喺呢個靈長類嘅呢個馬騮嘅實驗模型裏邊咧，係好清楚咧顯示到我哋用呢個 beta 干擾素咧係可以保護到嗰個猴子嘅感染。咁所以咧我哋就利用咧一個我哋叫做雞尾酒式嘅療法，即係我哋將幾隻藥咧一齊俾嘅。咁我哋就用咗呢個 Lopinavir 啦、beta 干擾素同埋呢個利巴韋林 Ribavirin 咧，同時間俾我哋嘅病人。咁而我哋呢一個臨床測試咧，已經獲得一個相當好嘅國際雜誌咧，已經 係會刊登㗎啦。咁但係因為今日為止咧，我哋未過嗰個可以講嘅時間啊，咁所以咧希望下次有機會同大家詳細分析。但係我哋想俾一個病人嘅案例你睇，就係呢一個咧係一個年長嘅伯伯啦，71歲，佢係有糖尿病嘅，咁所以你知道呢啲因素都令到佢係一個高危嘅人士。而咧第一日佢嘅入到嚟我哋醫院嗰個X 光片咧，左邊咧亦都見到咧係花晒嘅。咁我哋好擔心佢好似喺中間個 CT 咧會好快咁急速係轉差。於是乎我哋就得到佢同意之後，俾咗佢呢個triple therapy， 即係3重嘅藥物治療。而你見到喺4日內咧，佢喺右邊個肺片咧已經基本上係清咗好多，同埋可以話係行出咗個鬼門關。咁所以我哋呢個臨床嘅報告好快就會出㗎啦。咁我哋呢個就係我哋香港嘅做法。暫時。
多謝 ，Thank you so much, Dr. Chan. So we are coming very quickly to an end. Maybe we'll have Dr. Chin Hong answer a couple of questions before you leave. And those of you who can stay behind a little bit, maybe Dr. Chan can answer a little bit more. So we talk about the first question. There's a question about vitamin C and D. Any quick answers for that, Dr. Chin?
Yeah, the quick answer is not vitamin D, but vitamin C is being studied in the intensive care unit now as part of a big network in the United States as one of many therapies.
IV, not orally.
Yeah, because they are intubated patients.
Okay. So
can I make a comment?
Immune response. Huh? I'm sorry?
Can I make a comment on the IV high dosage of vitamin C?
Mm-hmm.
I actually request the hospital to do it for me for a few times every day and for a few days before anything due to me, but it was rejected because they said that it's not as FDA approved. Yeah. My brother is also a physician in Hong Kong, and he knows about there is a lot of people that does that, at least on the early stage for the patients, and was very successful.
Yeah, so it's being studied, Monica, right now as part of a trial.
Okay, sounds good.
Dr. Chan, do you guys do it in Hong Kong?
Not in the protocol because that would affect the clinical data, the outcome. So some patients want to do it, but this is not a very common practice.
What about the immune response? Some people have too much, some people don't have enough.
So that's concerning the cytokine storm phenomenon. So, even in our hamster model, we can show that we have seen that the hamsters also develop very significant changes in the chemokine cytokine levels. This is also compatible with what other investigators have found in COVID-19 patients. We always believe in severe influenza and coronavirus infections that there's an element of immunopathology, meaning that your own immune system, when they overshoot, they can damage your body as well. So this is why some people are now using immunomodulators. For example, interleukin-6 receptor antagonist, tocilizumab. And some people say that the preliminary data show that they are very effective. But we have not personally tried this. I understand that our friends in New York are using this and some in mainland China are using this.
And the next generation of the NIH studies is going to have Remdesivir plus another immunomodulator called baricitinib, which is a JAK1, JAK2. So it's the same idea, except it will be studied.
Right. 呢個係個免疫系統，有啲人咧就嗰個反應咧就好多，有啲人咧反應好少嘅。咁呢兩位醫生咧就話，而家會有一啲實驗咧係會去查用一啲減低呢個免疫功能嘅藥咧，係夾埋一啲去抗病毒嘅藥咧，係睇下個結果會唔會好啲。So there were more strokes reported, and it's been raising people's concerns in the United States, at least. Do you see that in Hong Kong, Dr. Chan?
So this is one of the phenomenon we are observing. Besides what Professor Chin Hong has mentioned about anosmia and ageusia, that is the loss of taste, right? We tend to believe that this virus may cause thrombosis, making the blood vessels clot, so that you can have stroke, and also in the arterial and arteries and veins, you can have clots. So some patients do believe do develop these phenomena. Whether this is very specific to the virus, we do not know. But this is the first time that this has been widely reported in coronaviruses, because in SARS there are not that many patients. This outbreak was stopped quite early, and in MERS there are only the case number up to today is still very low. So for COVID-19, this is a chance for us to understand better about severe coronavirus infections and what the complications are.
And before you go, I have to leave soon, but I just wanted to say thanks to another Dr. Chan, which is Margaret Chan, that SARS outbreak was very well contained. So I always remember that.
Thank you so much. So 多謝兩位醫生. So thank you so much for all the participants for this town hall and all the physicians that are here, as well as Monica, who brave herself to show, and talk about her illness. That is truly extraordinary. Thank you. 多謝各位參加我哋今日嘅城市論壇. Thank you so much. And 希望下次可以再見喺個網上。
身體健康。好。
Thank you.
再見。
拜拜。
Thank you so much.